আমরা করিনি। আমি একটু করেছি কিন্তু পুরোটা আমি বলছি আমরা আমি আজকে তোমার আমি ন্যারো দেখে বন্ধ করে দিয়েছি, এত কিছু দেখলে আমি পাগল হয়ে যাবো। সবই স্ট্যাটাস দেখলাম, আমিও স্ট্যাটাস দিয়ে বুঝলাম যে ইন্ডিয়া জিতে গেছে। আমি সবার স্ট্যাটাস দিলাম, তখন আরও বুঝলাম যে ইন্ডিয়া জিতে গেছে। 19শে নভেম্বরের বদলানে আমি পুরোটাই লিখেছি পড়াশোনা করতে এটা ফ্রিতে দেখাচ্ছে।
Let us focus in Korean. Let us focus. Today is a match, right?
Second set.
So today we're going to
Pen.
Okay, today we're going to discuss the pancreas. Okay, pancreas is a mixed gland, is it not? So why it is mixed gland? What? Okay, it's okay, not detailed, but roughly. Islets of Langerhans. Islets of Langerhans belongs to endocrine part or exocrine part? Islets of Langerhans belongs to which group primary? Endocrine part or exocrine part? Endocrine part. And the serous acini belongs to? Serous acini belongs to exocrine part. That's why it is mixed gland. Why liver is a mixed gland? The bile will be secreted through duct tubes. Okay, so that is the exocrine part. And what are the liver cells? Hepatocytes are releasing the glucose or whatever it might be. That belongs to endocrine part. Okay. So pancreas, you know that it's a how it appears? Lobulated, like elevated and depressed. Elevated and depressed will be the normal appearance of the pancreas will be like elevation and depression will be there. It is called the lobulated or globular appearance over here. Okay. So what are the parts of the pancreas? First of all, what are the parts of the pancreas? Which part is the head? First of all, where it is situated actually? The pancreas is situated in? What is it? Epigastrial. Epigastric region and left hypochondrial region. So do you think that it is extending all the way from left hypochondriac, epigastric to left hypochondriac region, or any other thing is there over there? So pancreas is present only in the epigastric and left hypochondriac regions, or any other region? Yeah, that's okay. T20 is kidney. What? Umbilicus. No. So with respect to the relation to the liver, so where it is related? Where it is related? For example, if you take the liver over here. Liver, where it is present? Right hypochondrial, epigastric and left hypochondrial. So where is the relation over here? Behind the quadrate lobe. Okay. Behind the quadrate lobe. This is the inferior vena cava on the posterior aspect. On the posterior aspect, this is the inferior vena cava over here. Here will be the two ligaments over here. What are those? Pectus venosus and ligament of venous of end. What's that? Ligament of venous of end? So this is quadrate lobe on the posterior aspect and this is the caudate lobe on the posterior aspect, is it not? But where does the duodenum extends on the posterior aspect? So duodenum on the posterior aspect will be extended even beyond the gallbladder and goes downwards, is it not? It will going beyond the gallbladder or behind the gallbladder towards the right side over here. So, what's it? What's it? Neck and body portions. Okay, what is this? Okay, so it will be crossing the neck and body or the gallbladder over here and goes towards the right lobe over here. Is it alright? So the pancreas, so within this concavity is the head of the pancreas. Is it alright? So the pancreas is slightly extending into the right hypochondriac region also. It is not given in the textbooks, but you have to imagine. Why so? Because if there is a pancreatic malignancy, that will be extending towards the right hypochondriac region. If the patient is complaining of pain in the right hypochondriac region over here, you should not only think about the hepatitis or related to the hepatic region over here, you should also think about the pancreas also. Getting it or not? So don't just ignore the pancreas at the level of the right hypochondriac region. According to the textbooks, it is related to the epigastric and left hypochondriac regions. But you have to imagine it is going towards the right hypochondriac region also. Okay, you have to imagine. Okay, anatomically, whenever you relate it, it will be extending slightly towards the right hypochondriac region. Got it? Please switch on the exhaust fan. E is written over there. Yeah, that's right. Okay. So the pancreas is present in theoretically epigastric and left hypochondriac regions, all the way from which vertebrae to which vertebrae? T1 to L3. Okay. So kidney will be extending in between. Kidney will be extending in between T12 to L3. We think that pancreas is also extending in between T12 to L3. No, obviously. So it is situated at the level of, or absolutely the head of the pancreas will be situated in between L1 and L2 over here. T12, L1, L2 and L3 over here. Right, imagine. Okay. So the pancreatic head will be extending in between L1 and L3 over here. But the tail is reaching up to the T12 vertebral level over here. Could you understand? Anteriorly, epigastric and left hypochondriac regions, but posteriorly, with respect to the head, it is related to L1 vertebra and L2 vertebra. Okay. But the tail is pointing upwards and backwards over here. Okay. So it is reaching almost onto the T12 vertebra over here. So head will be in between L1 and L2. And tail will be reaching the T12 level. This is the vertebral level for the pancreas over here. So posterior aspect. Okay. So what may be the relations of the pancreas over here? Just posterior to it. Anteriorly, to which it will be related, right? Very easy. Anterior to the pancreas, which structures will be there? What is it? Stomach above and below will be? In the middle will be transverse colon over here. Below the transverse colon will be intestines. Which intestines? Small intestine. It is small intestine most predominantly. Jejunum obviously, because ileum is situated downwards. Isn't it? Ileum is situated downwards and jejunum is situated above. Right? So on the anterior aspect of the pancreas, above will be the stomach and below will be the small intestine and the jejunum. In between both will be the transverse colon. Why so? Because from the pancreas there is the root of transverse mesocolon. So there will be a transverse colon over here. Above the transverse colon will be the stomach. Below the transverse colon will be the coils of jejunum over here. As simple as that, right? Behind the pancreas, what you can expect? Behind the pancreas, what you can expect? So at the level of the neck, I have told you there will be vertebra. Isn't it? At the level of the neck, there will be vertebra. So at this level, which structures you can find in front of the vertebra? Very easy. Inferior vena cava towards the right side and abdominal aorta towards the left side. Is it not? Right. So just behind the body you can find the inferior vena, just behind the neck and towards the beginning of the body you can find the inferior vena cava and the aorta, abdominal aorta. Okay, so we have found the relations on the posterior aspect in the middle, almost in the middle. Towards the right side it is related to no, not that much, right? Just behind the kind of the pancreas, which structure is present? What is it? Splenic artery, because kidney is related over here. Very good. Kidney is related over here. So this will be the hilum of the kidney over here. So what are the relations which are present over here? So obviously, ureter, splenic artery, splenic vein. A little below will be the gonadal artery. Is it not? Is it not? Just below the splenic artery is the gonadal artery. Is it or not? Right? So just behind the head will be the hilum of the spleen with the hilum structures of the hilum of the kidney with the hilum of the what are the hilum structures over here. Nothing but the renal artery, renal vein, and ureter, pelvis of the ureter over here. Okay, as simple as that. Just below that will be the gonadal artery towards the head over here. Okay, and towards the left side, what you can get over here? Towards the left side, extreme left side, here will be one more kidney. Is it all right? One more kidney. Right kidney will be a bit below because of the presence of the liver. Left kidney will be a bit above. Okay. So pancreas on the right side or right end, it is related to the hilum of the kidney over here. And on the left side also, the tail is related to the hilum of the kidney and towards the upper aspect of the kidney. Getting it out? Very easy relations over here. Anteriorly, we have found transverse colon horizontally in the middle. Above will be the stomach. Below will be the jejunal coils of jejunum over here. Okay. Behind we are seeing the right end will be having the kidney and the hilum structures over here. And the left end will be having again the hilum, of course, little bit towards the upper pole of the kidney organ or anti-surface of the kidney organ. In the middle we are getting the vertebrae. So vertebrae will not come in direct contact with the pancreas over here. In front of that will be the aorta towards the right side and inferior vena cava towards the left side. As simple as that, right? Right kidney, left kidney, inferior vena cava and aorta, right? Okay. So these are the basic relations with which the pancreas is related to. Okay, now let us see the parts of the pancreas. So this pancreas and the kidneys, by this you can understand, these are lying just behind the stomach. Isn't it not? Stomach is situated in left hypochondriac and epigastric regions. Is it not? Even the pancreas is also situated in epigastric and left hypochondriac regions. So just behind the, for example, stomach is present over here. Just behind the stomach is the pancreas and the kidneys on either sides. Got it already, people? Right? So let us see basic parts you know very well already. What is it? Which part is the head over here? How you can differentiate the head from the neck? And from head from the answer process? Exactly. Okay, first of all, the right hand is the head over here. Okay. Right hand is the head and that continues with the neck and further continues as the body and further continues as a tail. So where the tail is ending over here, whenever the kidney is present over here, that is the tail. Okay. So how to differentiate? For example, if you take this convexity over here and there is a concavity towards the left side over here. Okay. So if you extend the line above this and below this from this point over here. Okay. So this will be forming the head over here. That is getting separated from the neck, which is about 2 centimeters over here. Till this part is the neck. Okay, till this part is the neck, 2 centimeters. Okay. So below this line is separating the uncinate process and the head over here. So head is separated from the neck from above line. Head is separated from the uncinate process from below line over here. Uncinate process is a process which is an extension of the head over here. Getting it over? So first of all, this is the uncinate process. Uncinate process. And this is the head, and then followed by neck, and then followed by body, and then followed by last 3 centimeters or 3.5 centimeters will be the tail over here. These are the parts of the pancreas. Okay, you already know very well, right? So, now how it is peritoneally related over here? So behind the pancreas, do you think there is a peritoneum or not? Behind the pancreas, peritoneum is present or not, right? Why? Why it is absent behind the pancreas? Retroperitoneal. So obviously behind the pancreas there is no peritoneum, but rather there is a fold of peritoneum which occurs behind the head. What is that? Which will be hanging down due to the jejunal flexion with that of the right crust of the diaphragm. What is that? What is it? Ligament of Graves. Ligament of Graves. This will be passing all the way from the right crest and goes towards the So just behind the head there will be ligament of traits. For example, if you imagine the right crus of the diaphragm over here. From the right crus of the diaphragm, of course you know that musculoelastic tissue which will be passing behind the head and reaches the duodenojejunal flexure over here, which connects the duodenojejunal flexure with the diaphragm over here. Okay, right crus of the diaphragm. But behind this body of the pancreas, there will be areolar connective tissue behind the body of the pancreas. So that is termed as, what is it called? Fascia of Toll. Okay, just to remember over here, there is a fold over here which is coming all the way from the what is this? Right crus of the diaphragm till the duodenojejunal flexure over here. That is nothing but the ligament of traits just behind the head of the pancreas over here. But behind the body of the pancreas, there is a loose areolar connective tissue which have a particular name called fascia of Tolt. Okay, there is no separate significance for this, but the fascia behind the pancreas is termed as the fascia of Tolt. Right or not? Right? But in front of the pancreas, there are few peritoneal folds over here. What are those? So do you think that head is covered by the peritoneum or not? Head of the pancreas is covered by the peritoneum or not? And it is retroperitoneal, right? Covered by the peritoneum or not? Obviously, anterior part of the head is covered by the peritoneum. Is it or not? Right? But do you think that the entire anterior aspect is covered by the peritoneum or not? Why? Root of the transverse colon. So where does the root of the transverse colon is present? All the way from here and goes over here. Okay. Okay, all the way from here also. It's related to the peritoneal, what is it? Peritoneal fat. Fascia of Toll is behind the pancreas. Yeah. See here, yesterday we have seen that the duodenum is related to the neck and body of the pancreas and body and of course the unsaid process. Is it or not? The C-shaped curve of the duodenum will be present over here. Is it or not? Right? So we have related the transverse colon with the second part of the duodenum or the anterior aspect. Is it or not? Is it or not? Could you remember? So obviously it will be related to the anterior aspect of the body of anterior aspect of the head of the pancreas also. Is it or not? For example, this is the duodenum in this manner. So which part crosses the midline of the duodenum? Which part crosses the midline of the duodenum? The second part of the duodenum or the anterior aspect of the transverse colon, is it not? So obviously it will be partly passing in front of the pancreas also, head of the pancreas also. Could you understand? So because it is crossing over here, little bit of space will be made by this transverse mesocolon over here. Try to understand this, okay? Because the transverse mesocolon, how it is arising over here. So it will be arising at the anterior border of the body of the pancreas. This part is the body of the pancreas, right? This is the anterior border of the body of the pancreas over here. But the root of the mesentery, so root of the transverse mesocolon will be going towards the lower border of the neck of the pancreas over here. Getting it? and then it goes further over the head of the pancreas over here. Try to understand this. Could you understand or not? Right? So this is the transverse mesocolon, the root of the transverse mesocolon, from which the two layers will come over here and will be holding this transverse colon over here. Getting it or not? Right? So this root is extending all the way from the anterior border of the body of the pancreas over here, and then goes towards the lower border of the neck of the pancreas and goes further over the head of the pancreas over here. Getting it or not? So wherever the root is coming over here, above this part is the peritoneal covered area, and below this part is the peritoneal covered area. Could you understand or not? Because the root is converging over here. Above this part is the peritoneum over here. Below this part is the peritoneum over here. Is it not? Right? So this part of the head is covered with the peritoneum, and here this part of the head is covered by the peritoneum, apart from the middle part, because it is giving the root over here. Could you understand or not?
From his cover, how it is in the sort of pancreas.
Okay, fine. Okay. It's okay. So we'll see it in sagittal section so that you can understand. Okay. So the pancreas over here. Okay. And then followed by the stomach over here. Okay, this is the stomach, this is the transverse colon over here, this is the pancreas body level over here. Body. Okay. Body contains an upper border, a superior border, and inferior border, anterior border. Okay. We are at the body level, this level. Okay. So the lesser omentum will be coming all the way from the liver over here, which is situated a bit above towards the right side, and encloses the stomach. Right? Encloses the stomach. So this is the anterior layer and this is the posterior layer. And here we will be the lesser sac over here. Right? So these two layers will be joining together and will be forming the first and second layers, right, of greater omentum. So this is the lesser omentum, this is the greater omentum over here. And this will be reverted back over here in this manner and encloses the transverse colon over the anterosuperior surface over here. Okay. And then goes towards the body at the anterior border and diverges at this level. And this will be joining with the parietal peritoneum of the body, posterior wall of the body of the abdomen. Getting it? Okay. So here will be the liver over here, and here is the lesser omentum over here, right? And that will be extended to the stomach, and then followed by the greater omentum over here, greater omentum over here. So this will be, these are the four layers of the greater omentum. These will be joined over here later on, and then encloses the transverse colon over here, and then forms the transverse mesocolon. This is the transverse mesocolon. Okay. So this transverse mesocolon, this is the upper layer and this is the lower layer. Initially anterior layer and posterior layer, now upper layer and lower layer over here, because it is diverging in this manner. Okay. So this will be forming the root of the transverse mesocolon. We can say in either sides, right? A glass is filled with half of the level, or glass is half empty, we can say, right? So in that manner, this is the transverse mesocolon all the way extending from the transverse colon till the anterior border of the pancreas over here, or in a reverse manner, it is arising from the pancreas, forming the root of the transverse mesocolon over here. Root means the beginning point, is it all? And that will be going towards the transverse colon in a reverse manner. Getting it all? So because it is diverging over here, this part, the upper part, for example, imagine that this is a triangular area in this manner. Getting it all? So this is the upper surface and this is the lower surface over here. And the layers are diverging over here in this manner. Getting it all? So this upper part or upper surface is covered by the peritoneum over here, and the lower part is covered by the lower layer of the transverse mesocolon over here. Is it alright? Right? So in between those two, this is the area where there is an anterior border from which the root of the transverse mesocolon is arising over here. You have understood or not? Right? Could you understand that? Right? So the same root will be extending towards the head of the pancreas also, a little bit of small gap will be there over here. That's all. That is the only thing. Okay. So this upper part of the head is covered by the peritoneum over here. Lower part is also covered by the peritoneum over here. Again, at the level of the neck, you are supposed to understand neck is like a flat. The body will be flat. So So it will be having anterior surface and posterior surface. I tell you the borders and surfaces. Okay. First of all, let us see the pancreas, surfaces and borders. Okay. First of all, if you take the head, this part is the head. Is it not? This part is the head. So what are the surfaces? It is flat. Head is flat. Anteroposterior in this manner. So you will be having an anterior surface and posterior surface. This is the upper border of the head of the pancreas, and this is the lower border of the head of the pancreas. And this is the right border of the pancreas, and this is the left border of the pancreas. Okay, 4 borders and 2 surfaces over here. And again, the neck will be flat anteroposterior in this manner. So you should be having anterior surface and posterior surface and upper border and lower border over here. Got it? Right? And coming to the body, if you take it in a sagittal section, it will be triangular in this manner. So it will be having superior border over here and then inferior border, and there is an anterior border towards the anterior aspect of the abdomen over here. Got it? So this surface is called anterior surface or anterior superior surface. Okay, I don't think you can say, but basically anterior surface. And this surface is called inferior surface or antero-inferior surface over here. Basically inferior surface. Okay. And then this surface in between the upper border and lower border are posterior surface over here. So the fascia of told will be present over here. Getting it out? Right? So upper superior border, inferior border, and anterior border over here. This is the anterior surface, inferior surface, and posterior surface over here. Got it or not everything? Right? So this anterior surface is covered by this upper layer of the transverse mesocolon over here, and this inferior surface is lined by the lower layer of the transverse mesocolon over here. And behind the pancreas it is no peritoneum present, but there is a fascia which is called the fascia of Todd. Got it or not? So here from this anterior border is the root of the transverse mesocolon, that is this line over here in the middle. Got it or not? So this will be extending downwards in this manner and will be holding the transverse mesocolon in this manner. Could you understand? This entirely is the transverse mesocolon that will be extending all the way from pancreas and goes towards the transverse colon and will be holding the transverse colon over here. Got it or not? Got it or not? Right? So this is the attachment of the peritoneum over here. Okay. Then what about the tail? What about the tail? So tail will be extending into the spleen through a ligament in between the spleen and the kidney. What is that? Lienorenal ligament. Okay. For example, so this is the spleen, okay. This is the kidney over here, just behind the tail of the pancreas, and towards the left side of the pancreas or tail of the pancreas is the spleen over here. In between the spleen and the kidney, there is a ligament over here that is nothing but the lienorenal ligament. Through that ligament, the pancreas will be entering into the or reaching the high level, almost up to the high level of the spleen over here. Try to understand this. The tail is related posteriorly with the hilum of the kidney and little bit of anterior surface of upper aspect of the kidney. And the tail will be almost will be reaching the hilum of the spleen. We will be discussing that later. Okay, it will be reaching the hilum of the spleen over here. Okay, so this tail part is covered by which ligament? Lienorenal ligament over here. Getting it out? Lienorenal ligament, which is also a fold of peritoneum over here. Got it? Right? So these are the peritoneal coverings of the pancreas over here. Head, body, and of course neck and the tail over here. Got it? So the thing what you are supposed to differentiate over here is the neck is covered by which layer of the transverse mesocolon? Upper layer. Only upper layer, not the lower layer. But the head is covered by upper layer and lower layer. Body is covered by upper layer and lower layer over here. Okay, but the neck is covered by only by the upper layer over here. Because the root of transverse mesocolon is extending towards the lower border of the neck of the pancreas over here. Got it or not? It is deviating, taking a deviation downwards over here in this manner. Got it? Right? So far we have seen the parts and relations of the pancreas, is it not? Right? So the basic relations you are supposed to understand, just this part is the neck, is it not? So behind the neck there lies a vein that is nothing but portal vein in the upper half, and lower half will be superior mesenteric vein. Okay, see here, what are the things which are present at the head, neck and body? Okay, structures which are present at the head, neck and body. Okay, so there is a vessel which should be running in front of the neck of the pancreas over here. That is nothing but just at the junction between on the anterior aspect of the pancreas, in between the head and the neck, there runs an artery over here. That is nothing but gastroduodenal artery, because we have seen already duodenum first part will be over here, posterior to the first part of the duodenum, the gastroduodenal artery runs downwards. Okay, but that should enter in between the groove which is formed in between the first part of the duodenum and the pancreas over here, upper border of the pancreas over here. So it will be coming behind the first part of the duodenum, but goes in front of the pancreas and gives rise to superior pancreatico-duodenal arteries. What do you know? Superior pancreatico-duodenal arteries are the branches of gastroduodenal artery, isn't it? And the inferior pancreatico-duodenal arteries are the branches of superior mesenteric artery. Very good. So this will be dividing into anterior and posterior pancreatico-duodenal arteries, which will be supplying both head of the pancreas and the duodenum apart from first part of the duodenum. Could you understand? So these are the superior, anterior and posterior superior pancreatico-duodenal arteries, so which will be running in the groove between the duodenum and the pancreas, head of the pancreas over here, and supplies the head of the pancreas and the second part and third part and fourth part of the duodenum also. Getting down it? What about the first part? First part of the duodenum is supplied by superior, inferior and superior. What is it? Okay, in that manner you can say one more particular name is given, retroduodenal branch or dorsal duodenal branch. Okay, as we have seen, the superior, inferior and retroduodenal branches will be supplying the first part of the duodenum, second part, third part and fourth part will be supplied by superior and inferior pancreatico-duodenal arteries, which are the branches of gastroduodenal artery and superior mesenteric artery. Okay, right. So that gastroduodenal artery will be passing posterior to the duodenum over here, but enters into the groove in between the pancreas and duodenum, passing anterior to the pancreas over here. Got it or not? So behind the first part of the duodenum, but anterior to the pancreas over here. Okay. So whenever it is going in front of the pancreas, it divides the head from the neck of the pancreas over here. So for this artery, there is a notch at the junction between the head and neck of the pancreas. Try to understand this. We have divided the based on an imaginary line earlier, right? So, but how to differentiate anatomically? Here it is the presence of the gastroduodenal artery which is running in between the head and neck of the pancreas. On the anterior aspect, the head is separated from the neck by the presence of this artery by means of a notch over here. Try to understand this. But you would understand or not, right? So the head on the anterior aspect is separate from the neck by the notch which is present for the gastroduodenal artery over here. Okay. But behind the pancreas, behind the body of the pancreas, behind the head of the pancreas, which structure is dividing the head and neck of the pancreas over here? Nothing but the right margin of the groove for this portal vein over here. Okay, portal vein, there must be a groove. Just like the inferior vena cava groove in the liver, there will be a groove for the portal vein at the level of the neck of the pancreas over here. Getting it over? So the right margin for the portal vein over here will be separating the head from the neck of the pancreas. On the anterior aspect, gastroduodenal artery. On the posterior aspect, the right margin of the groove for the portal vein will be separating the head from the neck of the pancreas. Got it, everybody? Right? Right. So this is about 2 centimeters over here. So then the left margin of this groove for the portal will be separating the neck from the body of the pancreas on the posterior aspect. Could you understand or not? Right? But on the anterior aspect, there is no such specific structure to separate the neck from the body. This will be asked in the examination, try to remember this. Okay. On the anterior aspect, gastroduodenal artery separates the head from the neck. On the posterior aspect, the right margin of the portal vein groove will be separating the head from the neck. On the anterior aspect, the neck is not separated from the body by means of any structure over here. But in the posterior aspect, the left margin of the portal will be separating the neck from the body of the pancreas again. Could you understand? Right? And coming to the left end over here, whatever the part which is lying in front of the kidney is the tail of the pancreas. As simple as that. Just last 3 to 3.5 centimeters is the tail of the pancreas. Whatever it is lying in front of the kidney over here is the tail of the pancreas. As simple as that. Got it over everybody? Right? So these are the vessels in relation with the pancreas over here. And you are supposed to remember one thing over here. So this is the splenic vein and this is superior mesenteric vein. This splenic vein will be draining one more vein over here, that is nothing but inferior mesenteric vein. Okay, try to remember this properly. So this superior mesenteric vein will be running behind the pancreas and goes in front of the ulcerate process over here. Try to remember this properly. Portal vein will be formed behind the neck of the pancreas, but that will be crossing in front of the ulcerate process towards the right side over here. Get it out, right? And then this is a superior mesenteric vein over here, and this is the inferior mesenteric vein. Inferior mesenteric vein will be collecting the blood all the way wherever the inferior mesenteric artery supplies, and then it will be draining the blood into the splenic vein over here. Get it out? So splenic vein joined with the superior mesenteric vein will be forming the portal vein over here, but the splenic vein will be draining the inferior mesenteric vein over here. Get it out? So two veins, superior mesenteric vein and inferior mesenteric vein, are joining with the splenic vein at the pancreas over here. This you are supposed to remember. Getting it or not? Right? So I have already told you, whenever there is a portal hypotension or portal obstruction, what will happen to the spleen? Splenomegaly. Why splenomegaly occurs over here? Excessive storage of the blood, nothing but the congestion of the spleen over here. Because the venous drainage is not entering into the portal vein over here. So all the blood which is collected in the spleen will be stored there itself, leading to the splenomegaly over here. Okay. So now let us see the blood supply of the spleen over here. The head is supplied by, we have already discussed, head and ulcerate process will be supplied by superior and inferior pancreatic or duodenal arteries, which are the branches of superior and inferior mesenteric arteries. Okay, and then body will be supplied by, we have already discussed during the abdominal aorta. The body of the pancreas and tail of the pancreas are supplied by pancreatic branches of splenic artery. Even though pancreas is pancreas, because splenic artery will be running over which part? Superior border, all the way from superior border over here, and enters into the spleen over here. Is it or not? And splenic artery structures over here. Where is the celiac trunk? Celiac trunk will be situated just above an elevation over here. We have already discussed what is the elevation. Tuber omental of the pancreas, which lies just behind the tuber omental of the liver, lies in front of some structure. And tuber omental of the pancreas will be lying just behind one structure. Common structure. What is that? What does that mean? What is that? Tuber omentals will be lying opposite to each other, above and below. In between that there is a structure. What is the structure? It is separating two different organs of it. What is it? Forgot everything? Lesser omentum? Isn't it or not? Lesser omentum is separating both the tuber omentals, isn't it or not? So the liver is getting separated from the pancreas with the help of the lesser omentum or through the tuber omentals over here. Could you able to remember or not? Right? Right. Not only the cricket, you need this also. Okay, right? Yeah, that's what, right? For example, pancreas is for that you have to understand the relation. Check this. This is the liver over here. Tuber omental of the liver is present over here. Is it alright? But for example, the pancreas is extending in this manner because duodenum is related over here, right? Pancreas is going over here. So, going over here, right? But the tuber omentum of the pancreas is present over here. But the duodenum will be extending over here in this manner. So the first part is present over here. Okay, first part of the duodenum is present over here in this manner, right? So this is the first part of the duodenum. From here starts the stomach. This part is the stomach. This part is the stomach, for example, right? So this is the this one will be ligamentum venosus, from which the lesser omentum will go over here till the first part of the duodenum. Is it not? Right? Because the porta happens to be in this manner, so it will be going all the way from here. So this lesser omentum is absolutely separating two tuber omentals over here. So this is over the lesser omentum on the anterior aspect. This is over the lesser omentum on the posterior aspect of it. So both these are above and below and right and left. They are separating from each other. This tuber omentum separates the liver from the pancreas and pancreas from the liver through lesser omentum over here. Got it right? Got it or not? Understood or not? Right? Logical understood. See here, this is the tuber omental which lies just adjacent to the neck or medial end of the head over the upper border over here. Okay, try to understand. Just adjacent to the neck, just above the upper border of the head, body of the pancreas, or medial end of the upper border of the body of the pancreas over here. Is a tuber omental is an elevation. Just above that will be the celiac artery, celiac trunk over here. So you can imagine now abdominal aorta which is situated over here in this manner. Is it not? Abdominal aorta will be going over here. But you will understand. So this abdominal aorta is in relation with, see here, this is the tuber omentum of the pancreas over here in front, and even below the uncinate process also lies in front of the abdominal aorta. But you will understand. If you put the pancreas absolutely in front of the aorta, this tuber omentum will be in front of the aorta, and again this uncinate process is also in the same level over here. So the uncinate process also will be in front of the aorta. But you will understand, right? And the inferior vena cava will be situated over here. So the inferior vena cava is situated towards the head of the pancreas over here. But you will understand? Just behind the head of the pancreas is the inferior vena cava. Just behind the beginning of the body of the pancreas is the abdominal aorta. And at this neck level, there is a bend of the pancreas, yesterday I have shown you. Is it not? So at the level of the neck over here, there is a vertebra. That's why there is a bend, because this is going towards the paravertebral gutter and this is going towards the left kidney, which is again situated towards the paravertebral gutter over here. Could you understand? So the pancreas is in this manner. This is the entire pancreas. This is the neck of the pancreas, for example. So at the level of the neck of the pancreas, there is vertebral column in this manner, vertebrae. Okay. So the head will be towards the posterior aspect and the body and tail will be towards the posterior aspect. Only the neck portion will be projected in front. Okay. So this is the neck portion over here in this manner. This is the neck portion over in this manner. So abdominal aorta and inferior vena cava will be in front of the vertebra. Okay. So towards the body, beginning of the body of the pancreas is the aorta, and behind the head will be the inferior vena cava. But behind the neck will be the portal vein over here. Could you understand? So behind the neck is the portal vein, but behind the head is the inferior vena cava, and behind the beginning of the body of the pancreas is the aorta. Could you able to relate the things over here, right? Could you able to relate the things, right? Okay. So there is a duct arising from the gallbladder. What's it? Okay, so finally there will be bile duct, common bile duct. Is it not? First of all, there will be two hepatic ducts that will be forming a
common hepatic duct.
Common hepatic duct, and then joined with the cystic duct will be forming the bile duct, not common bile duct, not bile duct. Okay, this bile duct will be going posterior to the head of the pancreas over here, and passes in between the groove between the duodenum and the pancreas over here to open in the second part of the duodenum through major duodenal papilla. Is it not? So the bile duct will be going over here all the way from the liver and opens by means of a by a major duodenal papilla over here within the Which wall of the duodenum? Posterior medial wall. You have to be very specific. Posterior medial wall of the duodenum over here. Okay. Just above that will be a small opening that is nothing but minor duodenal papillae, through which one more duct will open over here. Axillary pancreatic. Axillary pancreatic may be absent in few individuals. Okay. But this will be definitely present. Okay. Main pancreatic. Okay. So this is a bile duct over here, which is joining with the pancreatic duct. Main pancreatic duct, which is arising from the pancreas over here, which will be draining all the way from the tail, body, and little bit of head over here, and forms a duct over here. That is nothing but the main pancreatic duct. Both of these ducts join together within the wall of the duodenum, forming a dilated portion is called dilated portion. That is called
ampulla of Vater.
ampulla of Vater. Okay, this dilated portion is nothing but the ampulla. Ampulla means a dilated portion over here. Okay, so that dilated portion will be opening at the summit of the papilla over here. Papilla means an elevation, a mucosal elevation over here. Okay, there will be a pore within the elevation over here. So that is the, so as a whole it is termed as the major duodenal papilla. Okay, could you understand? So this is the bile duct over here, which joins with the main pancreatic duct over here. Which joins with the main pancreatic duct over here. Could you understand? The tail and the body of the pancreas will be carrying the duct system over here. It will be carrying which structure? I mean, which things over here? Serous secretions. Is it or not? Serous secretions will be passing through this main pancreatic duct. Is it or not? Exocrine pancreas, right? So this duct will be joining with the bile duct over here. That will be forming the ampulla of Vater within the wall of the duodenum. Where is the ampulla of Vater? Within the wall of the duodenum over here. And which opens into the lumen of the duodenum through this opening over here. So this elevated portion is nothing but the major duodenal papilla. Above that will be minor duodenal papilla. Okay. So how the duct system is present in case of pancreas? Anybody? Herringbone pattern and everything? Anybody? Not studying yet, huh? So let us see the what is that? Exocrine part of the pancreas, the duct system. So the tail and the body of the pancreas and not partly the head of the pancreas. Tail, body and neck and head of the pancreas will be drained by this main pancreatic duct. So this duct is the main pancreatic duct. Whatever is the bigger size, that is the main pancreatic duct. Okay, that will be joining with the bile duct and that will be forming a bulge over here. That is nothing but the ampulla of Vater. So bile duct and the main pancreatic duct, which are entering into the duodenum, second part of the duodenum. Okay. So there is an accessory pancreatic duct that will be opening into the minor duodenal papilla through this accessory pancreatic duct over. Okay. This accessory pancreatic duct will be draining the secretions from the uncinate process over here. Accessory pancreatic duct will be draining the uncinate process over here. Okay. This duct will be going in front of the main pancreatic duct and opens into the minor duodenal papilla, which is situated in the wall of the second part of the duodenum over here. Got it? But these both ducts are connected by means of communicating duct. In between the two ducts, there is a communication over here. That is a communicating duct. Getting it or not? So the main pancreatic duct is connected to the accessory pancreatic duct by means of this communicating duct over here. But there is a term called, this is very much important. pattern of duct system is called the herringbone pattern. See here, this is like a stem over here for which multiple small branches are present over here. So this pattern is called the herringbone pattern. Okay, that will be seen in case of the main pancreatic duct over here. Okay, getting all the secretions from different areas of the tail and body over here, and will be draining into the main pancreatic duct over here. Getting it? So this setup is nothing but the herringbone pattern of main pancreatic duct. It is not present in the accessory pancreatic duct over here. What is it? Main pancreatic duct, it will be having a herringbone pattern over here. Understood or not? Right? So this is about the duct system, the arterial supply by means of superior inferior pancreatic arteries and the branches, pancreatic branches from the splenic artery over here. And venous drainage, splenic vein, and again superior inferior pancreatic veins over here. Getting it or not? Right? Right. So this is about the blood supply, and what about the nerve supply of the pancreas? Why the pancreas needs nerve supply? Pancreas is a gland. Why does it need a nerve supply? And which nerves will be supplying the pancreas? What's that? Squeezing. Okay, fine. Alright. So what is the impact of the nervous system on the pancreas? Parasympathetic nervous system? Absolutely. The exocrine part of the pancreas will be, what do you say? The glands will be releasing the secretions by the squeezing action of the, which muscles will? In area? In the walls of the glands, there will be particular muscles. What are those muscles? It's okay. It's about the history. It's okay, fine. So the nervous system will be what it does. The parasympathetic nervous system will be squeezing the glands so that the secretions will be released into the ducts. That is one use. What is the other use? What is the other use? So if there is any inflammation of the pancreas, the pain sensation will be carried through the sympathetic nerves over here. Could you all understand or not? Okay. Parasympathetic nervous system to squeeze the glands over here to release the secretions, but a sympathetic nervous system to carry the pain sensation all the way from the pancreas towards the spinal cord, through which cords over here? Again, T6 to T9. Same, just like this stomach nerve supply over here. Getting it over? So if there is any inflammation of the pancreas, that will be nothing but the pancreatitis. So that pain will be referred to which part of the abdomen? Anterior aspirational epigastrium. T6 to T9. Sorry, not T6 to T9. T6 to T12. Sorry. Not T6 to T9. T6 to T12. Thoracic spinal segments over here. Getting it over? T6 to T12 thoracic spinal segments over here. So it will be radiated to the entire abdominal wall over here. Is it alright? T10, 9, 8, 7, and below that will be 11 and 12. So the upper aspect of the and middle part of the abdomen will be carrying the referred pain of the pancreatitis over here. So do you think that pancreatic pain will be radiating towards the back or not? So this pancreatitis pain, if there is any inflammation of the pancreas, that will be carried to the sympathetic nervous system all the way to the T6 to T12 segments of the spinal cord over here. That will be radiated to upper and middle part of the abdomen over here. T10 is the umbilical level, T12 is little below over here, and above that will be 9, 8, 7. Is it not? The dermatomes over here. So entire abdomen, all the way from the umbilicus, just above that will be the referred pain which will be carried from the pancreas. And do you think the pancreas will be carrying pain sensation towards the posterior abdominal wall or what? So there are two pains. One is the pain from the stomach, one is the pain from the pancreas. How you will differentiate? Because both are situated in the epigastric region and left hypochondriac region, how will you differentiate both the pains? Whenever a patient comes clinical with these things. No, everywhere. Stomach is in front, pancreas is behind. Anywhere if you press, automatically it will pain. You can't differentiate. Very easy. See here. The pancreas is retroperitoneal, but not the stomach. Stomach is in front over here. So it is not reaching the posterior abdominal wall. For example, there is a pancreatitis because of alcoholism or any infection or whatever it might be. The inflammation will be straight away hitting the posterior abdominal wall over here. Getting it out? So the somatic nerves will be getting stimulated over here, that pain will be carried over here. Could you understand? So the pain of the pancreatitis not only reaching the anterior abdominal wall, but because it is of close proximity with the posterior abdominal wall over here, the inflammation will be hitting the somatic nerves over here. Again, the pain will be carried over. So the pain from the pancreatitis not only goes in front, but also towards the back. So if a patient, non-alcoholic, complains of pain only in the front over here, then what you will suspect? Only in the front, and of course towards the thorax over here, towards the chest. What you will suspect? Stomach pathology. What you will find? Gastric ulcer or gastritis or what you will find. But whenever the patient is complaining of pain on the anterior aspect as well as the posterior aspect over here, then you can think of the pancreatitis over here. Got it or not? This is the basic difference you can understand, right? Anything in history? Pancreas? Parts, artery supply, nerve supply. Parasympathetic nerves will be squeezing the glands and everything. That will be releasing the secretions over here. Okay? That's all, no? So if there is any injury to the pancreas, what will happen? If there is any injury to the pancreas, by means of a hit or by means of a gunshot wound, the secretions will be
digesting this fats and
absolutely. The secretions, nothing but the enzymes from the pancreas will be released into the peritoneal cavity that will digest the fat and the muscle protein over here. Okay, getting it out? So, and one more thing.
sir, what will it was after that digestion, what will happen?
For example, so what will happen after the digestion of the proteins from the muscle, skeletal muscle? Okay, what will required to the muscle? Okay. For example, the enzymes are released into the peritoneal cavity. We have psoas major or smooth muscle, or what are required, right? So, for example, take the psoas major. Psoas major is skeletal muscle or smooth muscle? Skeletal muscle. Skeletal muscle will be having a protein. What is the protein termed as? What? Myoglobin is the protein which is present in the muscles. Okay. So whenever there is a digestion of the digestion of the muscles over here, this protein will be released into the blood circulation over here. Whenever this is releasing into the blood circulation, this myoglobin is toxic to the kidneys. So this myoglobin will be destroying the kidneys over here. So the patient will die of what is renal failure? Obviously. Do you understand? So if the pancreatitis, if the injury to the pancreas is not treated, so this will happen. Could you understand? So the enzymes will be released into the peritoneal cavity, that will be digesting the muscle protein. The muscle protein will be released into the blood circulation. That myoglobin will be ultimately passing through the kidneys, damaging the kidneys, and the patient will die of renal failure. What it already means, right? So the malignancy of the head of the pancreas is very much common. Okay. So if there is a malignancy or enlargement of the head of the pancreas, what effects you can suspect? What effects you can guess? What effects? What is it? First of all, there is an obstruction of the bile duct over here. So what will happen to the patient? If there is an obstruction to the bile duct at the level of the head of the pancreas because of the malignancy, the patient will end up in obstructive jaundice. What it means actually? Obstructive jaundice means. Absolutely, the bile will be reverted back and the bile will be mixing into the blood. Do you think that normally the blood and bile will be mixed together? No. Okay. So here there will be mixture of blood and bile over here. That is nothing but the jaundice. Obstructive jaundice. Entering of the bile into the blood and reaching the various areas of the body is called the jaundice over here. Okay. Right. Then what are the other effects you can expect over here? Because the portal vein is very much close over here. So whenever the malignancy of the head occurs, there will be an obstruction to the portal vein also. Obviously again, there will be portal hypertension and again there will be splenomegaly over here. And there will be ascites formation over here. Got it alright? Right? And what else? What else you can expect over here? Duodenum, absolutely. The duodenum is passing over here. Because of this malignancy, it will be obstructing the first part of the duodenum. Right? So first part of the duodenum will be obstructed by means of this malignancy of the head of the pancreas over here. So first part will be obstructed by this of malignancy, and second part yesterday I have told you what terminology related to the pancreas. Conservativities. Angular pancreas. What is angular pancreas? The head of the pancreas will be formed by two parts embryologically. Those must be united towards the medial aspect of the duodenum over here, okay, towards the left side of the duodenum. But they are going around the second part of the duodenum. That is nothing but the angular pancreas, just like a ring around the second part of the duodenum. Okay, that will be obstructing the second part of the duodenum over here. Right, Arun? Third part of the duodenum, the body building and everything. Right? The superior mesenteric artery with the aorta over here. Right? So these are the various aspects of the malignancy of the head of the pancreas. So the question will be given in this manner. So patient is complaining of pain in the right hypochondriac region, okay, and he is found to have the splenomegaly over here, okay, and then the patient is having the dilated abdomen, okay. What do you suspect? Pain in the right hypochondriac region. There is a splenomegaly on clinical examination, and the patient is found to have abdominal dilatation or expanded abdomen. So with the fluid within the abdomen, what do you think? What do you suspect? What is it? Portal hypertension because of the obstruction caused by carcinoma of the head of the pancreas. So the same patient, okay, the same patient with a pain in the right hypochondriac region, because it will be pressing on the other structures, adjacent structures over here. Okay. So the pain in the right hypochondriac region, and the patient is found to have the jaundice. What do you think of? Obstructive jaundice because of the malignancy of the pancreas over here. Right? For example, during splenectomy over here.
Sir, how will this case be different from gallstone?
Gallstones by ultrasound or CT scan we can differentiate. We can think of
in the question if it is given, we have to write a diagnosis.
Yeah, definitely. For example, the patient is having the jaundice. Okay. So they are saying it as obstructive jaundice, but they haven't mentioned anything about the pancreas. So obviously you will think of gallstones only, obviously, because of the jaundice you might think of many things. Okay. So the jaundice has occurred over here, but the clinical findings must be mentioned over there. Get it or not? If the no clinical findings are mentioned, like ultrasounds things and everything, if they don't mention, you can't identify. That's why the tests are there over here. Okay. So there will be multiple things, but for the CT scans and ultrasounds and MRI scans, whatever it might be, those will be the differentiating factors over here. Right? Okay. If the patient is undergoing splenectomy over here, so for example, if a patient is met with an accident, okay, road traffic accident, the spleen is getting injured over here. Okay. So because of the splenic injury, there will be massive hemorrhage because spleen is a temporary storage organ of the blood over here. Okay. So in that condition, we have to remove the spleen. Nothing but the splenectomy over here. So whenever the splenectomy is doing, if the surgeon is not careful, the tail part of the pancreas will be removed accidentally along with the spleen. So what the patient might be landing up in? Insulin deficiency. So the patient will be landing up in diabetes mellitus. Try to understand this. Okay. So whenever the surgeon is removing the spleen as a matter of splenectomy, by accidentally he removes the tail of the pancreas along with it, because the tail contains most of the islets of Langerhans over here. So the patient will not be producing the insulin over here. So obviously the patient will be landing up in diabetes mellitus, whatever we say as sugar. Okay. So these are the things which are related to the pancreas over here. We have to finish, right? Spleen we can finish off fast, not like pancreas. Spleen is a bit good. Okay? Okay. Whenever you enter into the medical college, you have to develop a lot of patience. Okay? Yes, sir. Okay, right? See how much patience you'll be showing during other activities, right? By playing or whatever it is. Right? Okay, right. Let us see that we'll finish it up fast. We'll finish it up fast. You know already the spleen, you would have studied already. Let us discuss. Okay. No, not studied. Confidence.
Or as
Definitely, I have. Have you studied the spleen or not? No. I'm accepting yes. Right? It's okay. So, spleen is very good structure. Okay, we'll finish it up fast. Okay. First of all, where the spleen is situated? Spleen is situated in left hypochondrium and little bit in the epigastric region. Getting it over? So stomach, epigastric and left hypochondriac regions, and of course umbilical region also. And the pancreas, epigastric and left hypochondriac regions. In the same manner, spleen in the left hypochondriac region and epigastric region over here. Spleen will be lying towards the posterior-lateral aspect of the fundus of the stomach over here. Try to understand this. If this is the entire stomach over here, this is the entire stomach over here, this part will be the fundus. The fundus is related to the spleen over here. Could you even understand? Could you even understand or not? The fundus of the stomach is related to the spleen. That means the spleen is lying just towards the left side and posterior aspect of the fundus of the stomach over here. Got it or not? Right? So epigastric and left hypochondriac regions. Okay. And this is related to 3 ribs. What are the 3 ribs? 9, 10 and 11 ribs over here. This you are supposed to remember. Okay, 9, 10 and 11 ribs over here. Okay. Until what extent the lungs will be related over here to the spleen over here? 6, 8 and 10, but it is related towards the right side. Why? Because diaphragm, right dome of the diaphragm is a bit above. So 6, 8 and 10, but here it is a bit below over here. Okay. The lung will be reaching till the 10th rib over here. Try to understand this. The right dome of the diaphragm is above. So 6, 8 and 10. The lung levels will be, lower part of the lung will be. Here will be a bit below. So towards the mid-axillary line, on the other side is the 8th rib over here. But towards the mid-axillary line on the left side is the 10th rib over here. Try to understand this. The lung will be extending till the 10th rib over here. Could you understand? And from here it will be reaching, that nothing but the costo-diaphragmatic recess will be reaching till the 11th rib over here. Try to understand this properly. Okay. So the lung will be present in the 10th rib over here because left dome of the diaphragm will be a bit below over here. Getting it out? Right? So there, this rib is over, that area is the 8th rib, but here it is the 10th rib over here. Okay, try to understand this. Okay. Okay. What are the parts of the spleen? What are the parts of the spleen? There is a medial end and a lateral end. This you are supposed to understand. The medial end is rounded over here. Medial end is rounded over here, and the lateral end is like a base. If you take it as a triangle in this manner, the lateral end is like a base over here, and the medial end is rounded over here. Getting it or not, everybody? Getting it or not? The last girls and guys, getting it or not? Right? I know you're training, but still, you're supposed to focus. We'll finish it up fast. Okay. So this is the lateral end, which is broader area over here. Nothing like just like the base of a triangle over here. Okay. So there are a few borders of the spleen over here. Towards the upper aspect, this is the superior border. Towards the lower aspect, this is the inferior border over here. And between these two borders, okay, in between these two borders, towards the stomach is the visceral surface. Outside the stomach, outside the or towards the diaphragm is the diaphragmatic surface. This area is the diaphragm over here. So this surface is the diaphragmatic surface, and this surface is the visceral surface over here. Could you understand or not? Spleen, if it is in this manner, so this is the diaphragmatic surface. This is the. So leave it. Okay, so if the spleen is in this manner, so this surface is the visceral surface, which is related to the stomach and the kidney over here. This surface is the diaphragmatic surface, which is related to the diaphragm at this level over here. Getting it? So, towards the visceral surface, there is one more border over here, that is nothing but the intermediate border over here. Towards the visceral surface, there is a border in between the two borders over here. That is nothing but the intermediate border. Got it or not? At this intermediate border lies the hilum of the spleen over here. Getting it or not? Right? So, there are two angles at the lateral end of the spleen over here. What is the angles? See here, so far we have seen the borders and the surfaces at the two ends over here. And the other things are anterior basal angle and posterior basal angle. What do you think the angles over here? Which angle is the anterior basal angle? Which angle is the posterior basal angle?
Basal surface is continuous with the inferior surface. Continuous with the lateral surface. We come to the inferior basal angle.
Which one? I mean, you mean this one or this one or this one? Or which one?
Okay.
This one? This one? What is this?
चलो गेस करो
This one? So, this is the anterior basal angle and this is the posterior basal angle over here. Okay? I know. Okay. See this part. Okay, see this part. Okay. So this is exactly almost like the spleen over here. Okay. So this is the lateral end of the spleen over here. So this is the anterior basal angle and this is the posterior basal angle. It is a bit anteriorly placed. Could you understand or not? Right? So if you keep the spleen in elliptical position in this manner, so this is a bit anterior over here and this is a bit posterior over here. Could you ever see that? So this is the anterior basal angle, like a base over here. Anterior basal angle extended towards the left side and posterior basal angle towards the right side over here. Here only will be confusing over here. Getting it out? Right. So these are the two angles. In between these two angles, this is the lateral end. It is not a border. It is the lateral end in between the two angles over here. Getting it out? So medial end and lateral end is this much. The lateral end and the superior border will be separated by this angle, nothing but the anterior basal angle, and the lateral end and the inferior border are separated by posterior basal angle over here. Got it or not, everybody? These things you will be confusing. That's why I am repeating again and again. Okay? Okay. So, coming to the axis of the spleen over here. Axis of the spleen will be passing through which rib? For example, if you keep the spleen in this manner over here, 9th, 10th and 11th ribs over here. So the 10th rib will be acting as an axis of the spleen. Okay, if you keep the spleen in this manner, the obliquity in the middle will be carried by 10th rib over here. 9, 10 and 11th ribs over here. So the 10th rib acts as an axis of the spleen over here. Getting it out, right? So this is the obliquity of the spleen which will be carried by 10th rib in this manner. Ribs are directed in this manner, obliquely downwards. Isn't it not? Right? So, towards the diaphragmatic surface there will be diaphragm and further followed by the lung and the pleura over here. Nothing but the costo-diaphragmatic recess over here. Is it not? That is those are the relations for the diaphragmatic surface over here. And coming towards the visual surface, the intermediate border will be dividing the entire visual surface into two parts over here. One is above and one is below. Above it is related to the fundus of the stomach and below and behind it is related to the upper end of the kidney or upper part of the anterior surface of the kidney over here. So above stomach and below kidney over here. Could you able to imagine or not? Right? Stomach is in front, kidney is behind. In between these two is the spleen. So upper part will be occupied by the fundus of the stomach and lower half will be occupied by the anterior surface of the upper part of the kidney over here. Okay, getting it alright? So above stomach, above by means of stomach over here, below by means of kidney. In between these two and in front of the hilum, there is an impression over here for the tail of the pancreas over here. So the tail of the pancreas will be moving all the way over here. Getting it alright? So in that manner, it will be supplying the splenic artery and receiving the splenic vein over here. Getting it alright? Right? So the pancreas will be going all the way and the tail of the pancreas will be reaching till this impression over here. This impression is called the pancreatic impression. This tail of the the pancreas will be passing through which ligament? Tail of the pancreas will be passing through leno-renal ligament. Leno-renal ligament. Through that ligament, the tail of the pancreas will be reaching the spleen over here. Getting it alright? Right. So this is the pancreatic impression. A bit in front of the pancreas, there is an impression over here that is nothing but colic impression. Which impression is colic impression? See here, what are the impressions on the visceral surface? Above the medial border or intermediate border will be stomach, fundus of the stomach. Below the intermediate border will be kidney over here, anterior and upper part of the kidney over here. And just in front of these two impressions, there will be tail of the pancreas or pancreatic impression. Even below will be the colic flexure. Which colic flexure? Left colic flexure. Okay. But the thing over here you are supposed to understand is this left colic flexure will be hang from the diaphragm by means of a peritoneal fold over here. That is nothing but phrenico-colic ligament. Phrenico-colic ligament you can say. Phrenico-colic ligament. Exactly. See here, there is a peritoneal fold all the way from the parietal peritoneum, from the diaphragm will be hanging this left colic flexure, which will be supporting this lateral end of the spleen over here. So the lateral end of the spleen will be hanging over this fold over here. That is nothing but the phrenico-colic ligament. Diaphragm, phrenico-colic, left colic flexure ligament over here, which is also termed as sustentaculum lenis. Sustentaculum means whenever a structure is supporting other structure, that structure is nothing but the sustentaculum. So this fold is now acting as a sustentaculum lenis. Lenis means spleen again. Leno-renal. Lenis, spleen. Okay. So sustentaculum is nothing but the fold of the peritoneum which is holding the left colic flexure to that of the diaphragm. So this fold is nothing but the sustentaculum lenis, okay, which is nothing but the phrenico-colic ligament over here. Got it already, everybody, right? So because of the presence of this ligament, if there is any splenomegaly, the spleen will not be enlarged in a downward manner. Get it alright? The spleen will not be enlarged in a downward manner because it is obstructing over here. So rather it will be enlarging towards the right iliac fossa in this manner. Getting it alright? Because of the presence of this ligament, it will not be allowing downward enlargement over here, or the spleen. But the spleen will be enlarged obliquely downwards and comes towards the right iliac fossa over here. Getting it alright? Because of this presence of the ligament. Whatever the reason for the splenomegaly might be, lymphoma or malaria or whatever it might be. Okay. So these are the parts and relations of the spleen over here. Okay. Towards the hilum, there will be obviously splenic artery, splenic vein, and the lymphatics and the nerves, which will be going into the and out of the hilum of the spleen over here. So this is the hilum of the spleen, just lies above the intermediate border of the spleen over here. Okay, getting it down right? So visceral surface, these are the relations. Under the diaphragmatic surface, diaphragm and parietal pleura, and the lung and the pleura will be the relations over here. Getting it down right? So for example, if there is a inflammation of the spleen over here, there is an infection of the spleen. So what will happen to this pleura over here? Because there is a close relationship between the spleen and the pleura and the lung over here. So if there is an infection in the spleen, for example, okay, there is a less immunity in case of patient. So the spleen is getting infected or the spleen is inflamed over here. So what will be the other effects which will be produced by this inflammation of the spleen over here? Pleuritis, absolutely. So this inflammation or infection will be reaching into the pleura. There will be inflammation of the pleura, that is nothing but the pleuritis, that is leading to the pleural effusion over here. If it goes further upwards, it will be infecting the lung also. So if the patient is having any pain in the right hypochondriac region, he may also develop the respiratory distress because of the extent or because of this, invasion of the infection towards the pleura and the lung over here. Getting it alright? Getting it alright, right? Okay. So, now what are the peritoneal folds around the spleen? You already know that. What is it? What are the folds? Exactly, gastrosplenic ligament and lienorenal ligament, and one is in between the diaphragm, phrenico-splenic ligament. Okay, very good. What right? What is it? Okay, see here. So here is a spleen over here. For example, there is a spleen over here. Here is the stomach, and here is the kidney over here. Could you remember? Right? So this is the stomach, and this is the spleen, and this is the kidney. In between the stomach and spleen, there is a bilaminar fold over here. That is nothing but gastrosplenic ligament over here. In between the spleen and the left kidney, there is one more ligament over here. That is nothing but the lienorenal ligament. Through this ligament, the pancreatic tail will enter over here, and through this ligament, the short gastric arteries and gastroepiploic artery will enter over here. Getting it out, right? Right. And one more ligament is nothing but phrenico-splenic ligament over here. There is a fold of peritoneum which will be extending all the way from the upper margin of the lienorenal ligament and connects this ligament with that of the diaphragm over here. So this is one more ligament that is nothing but the phrenico-splenic ligament over here. Getting it over? So in between the ligament related to the spleen over here is the diaphragm over here. Getting it over? So for how many ligaments? This is the phrenico-colic ligament over here, and gastrosplenic ligament, and lienorenal ligament, and phrenico-splenic ligaments over here. Understood or not? By these ligaments, the spleen will be kept in position over here. Getting it over? Right? Right. Okay. See here everybody, this is the lienorenal ligament and this is the gastrosplenic ligament. So whenever these two folds are present, this entirely is termed as pedicule of the spleen. Pedicule of the spleen means whenever the gastrosplenic ligament and lienorenal ligaments are joined together, though that is nothing but the pedicule of the spleen. What is that? Pedicule. Pedicule of the spleen over here. And one more thing, there is a ligament I have told you in between the lienorenal ligament and the diaphragm over here, that is nothing but phrenico-splenic ligament. This is also termed as suspensory ligament of spleen. This ligament is termed as sustentaculum lenis because one structure is supporting other structure over here. But this is suspensory ligament. It is suspending the spleen over here, nothing but the suspensory ligament of the spleen, that is nothing but the phrenico-splenic ligament over here. Getting it alright? Right, right, right. Okay. So among these two layers of the gastrosplenic ligament, which belongs to greater sac and which belongs to lesser sac over here. Among these two layers of the gastrosplenic ligament, which belongs to greater sac and which belongs to lesser sac. Posterior layer belongs to lesser sac, anterior layer belongs to greater sac. Among these two layers, anterior layer, lesser sac, posterior layer, greater sac, absolutely. See here, in between these two is the lesser sac over here, as simple as that. Behind the stomach is the lesser sac, or in front of the pancreas is the lesser sac over here. So this posterior layer of the gastrosplenic ligament belongs to lesser sac, anterior layer belongs to greater sac over here. And among these two, this anterior layer will be belonging to the lesser sac over here. This layer belongs to the greater sac over here. Understood or not, everybody? Right? And then followed by the spleen is, okay, for example, if there is a malignancy of the spleen, there is some important point over here. So difference between malignancy of the kidney and malignancy of the spleen, how you will differentiate. This you are supposed to know. How you will be? Anybody? Anybody has studied, right? See here, try to understand this properly. For example, there is a malignancy of the spleen over here, or if there is a malignancy of the kidney over here. Spleen is related to the kidney over this part. Is it alright? So both are very much close to each other, but you are supposed to identify the difference. From which organ there is a mass formed over here, right? How you will differentiate? For example, this is a left colic flexure over here. For example, there is a kidney malignancy or renal cell carcinoma over here. Okay, kidney malignancy. So whenever the kidney will be enlarging, it will be pushing the, what is this, descending colon or colic flexure towards the front over here. Is it not? But whenever the spleen is getting enlarged, it will be pushing the colic flexure downwards in this manner. Is it not? Because colic flexure is just adjacent to the lateral end of the spleen. Whenever the splenic enlargement, because of the malignancy occurs, so it will be pushing the colon downwards over here in this manner. Okay. But whenever there is a kidney malignancy, it will be pushing the colon in front. Colic flexure will be in front over here. So whenever you find a mass over here in this manner, you have to percuss over the mass. Okay. So there is only dull note just below the costal margin, no resonance. So then you can say it as spleen. Getting it alright? But if there is a resonance, whenever you percuss just below the costal margin, that indicates renal cell carcinoma or kidney malignancy over here. Why it is so? Why it is sorry? Why resonant and why dull over here? For example, there is a mass which is protruding out just below the left costal margin. That you have to differentiate, right? So I have already told you, if this is the spleen over here, for example, the colic flexure will be over here. Whenever the spleen grows, it will be pushing the colon downwards over here. So just below the costal margin, if you tap, you are tapping over the spleen. So that gives rise to dull note. But whenever there is a kidney malignancy, all the way from posterior to anterior direction, it will move. Is it not? So this will be pushing the, already there is a colic flexure over here. So that will be pushed in front rather than the spleen. So if you percuss at this level, there will be resonance because of the air present in the intestine over here. Understood or not everyone? So just below the costal margin, if it is resonant, then it is kidney malignancy. If it is dull, splenic malignancy over here. Okay, these are the technical things that so everything. Okay. So if you remove the spleen in the manner of splenectomy because of the rotorific accident, what complication the patient will face? Malaria. Anemia. Okay. Any other? Low immunity. Very good. So whenever you do a splenectomy to a patient, the complications are, one is a diabetes mellitus because of accidental removal of the tail of the pancreas, or anemia over here, or immunity will be lacking over here. The immunity will become reduced. Why so? Why immunity is reduced over here? Why immunity will be reduced, right? Why immunity will be reduced? Why immunity will be reduced, right? What is it? Absolutely. It is secondary lymphoid tissue. It will be manufacturing the lymphocytes which will give rise to the immunity. So part of the immunity is reduced because of the splenectomy over here. Getting it or not? Right? So if you remove part of the spleen, it will regrow. If you remove part of the liver also, it will regrow. Could you understand? And liver and spleen moves with respiration. Getting it or not? Whenever the spleen is moving with respiration, the tail of the pancreas also moves with the respiration. The tail of the pancreas, even though it is retroperitoneal, it will be moving with the respiration because spleen is moving with the respiration over here. Getting it or not? So part of the spleen, if you remove, it will regrow. Part of the liver, if you remove, how much part of the liver you can remove successfully?
75%.
75%, not 2/3. 2/3 of the liver you can remove and you can survive still. Getting it or not? So what is the blood supply of the spleen? What is the blood supply of the spleen? Splenic artery. Okay. And venous drainage, splenic vein, nerve supply. Again, sympathetic and parasympathetic. The pain on the spleen will be carried by sympathetic nervous system over here. Is it or not? Is it or not? Right? As simple as that. Let us see the viscera.